participants is a vital component of every clinical trial, and for the best possible outcomes for the study, early patient recruitment is a necessity. Delays in patient enrollment extends the trial, which increases the cost for pharmaceutical companies around the globe. Approximately 80% of clinical trials fail to meet their enrollment timelines. The culprits behind these delays are a combination of several things, such as marketing decisions, operational issues, and highly restrictive selection criteria. Also, the increase in competition between different clinical sites for a similar therapeutic area leads to further delays, since each of these studies is simultaneously competing for the same pool of volunteers. Whatever the cause, a delay in recruiting patients for a clinical trial has negative implications, which is why you need to choose the right approaches to patient recruitment to avoid these setbacks. The eligibility criteria of a clinical trial. A large timeline is necessary to recruit and screen patients, although pushing off recruitment until later into the trial will definitely lead to delays, since it will take longer to complete the recruitment phase, and this may alter the outcome and outlook of a clinical trial. There is a study published by Kenneth Getz, a director at the Tufts Center for Study of Drug Development, and also associate professor at the Tufts University, found that there is a 94% increase of the recruitment period for studies challenged by recruitment. Or in other words, if you face a delay because you didn't take proactive efforts, usually leads to a double recruitment timeline period. Although this may be better than some of the trials that have to be canceled because of these delays in the process, or some of them have to have their funding reduced. The study also revealed that the highest increase in enrollment timelines compared with studies centered on more common chronic diseases. For instance, patient enrollment timelines increased by 116% for trials focused on neurological disorders such as Alzheimer's disease, and up to 113% for trials focused on metabolic and endocrine diseases, including diabetes. This notable increase may be caused or worsened by the presence of many studies running concurrently, depleting the number of volunteers available. Comes the last-minute patient recruitment efforts, there comes a need to take urgent measures to avoid further delays and also meet the extended timeline. These delays are expensive, costing sponsors about $60,000 per extra day, and the potential revenue loss can be at about $600,000 to $8 million every day the trial is delayed. These are staggering numbers, but it's not surprising since clinical trials are pricey in general. Delays in patient enrollment, and in turn the overall trial, may reduce the patent window and the profitability of a drug, as I mentioned before. This amplifies the financial loss associated with recruitment. Between 2008 and 2013, this financial loss has increased by more than 157%. This cost affects all stakeholders in the trial, including the investors, investigators, the sponsors, and CROs. Delays lead these groups to reduce their overall involvement in the trial, shifting their attention to other activities. Delays in completing patient recruitment within a clinical trial places an unnecessary burden on the patients. These pressures can lead to dropouts later in the study because of unresolved patient questions and issues. With so many things that go in during the trial, we forget that the recruitment process should be a thorough one which should not only involve enrolling participants into a trial, but also building a bit of rapport and relationship with them before the study. We forget the human side of clinical trials, and as we try to manage all the procedural side of the studies that come with conducting a clinical trial. That's why patient recruitment done at the tail end of a study rushes this process, which usually leads to bypassing the part where researchers get to learn about their patients personally. This weakly developed relationship may drive many patients to leave the study because they're just too timid to ask questions they want to, or to get the issues that they want addressed. The delay in enrollment impacts the quality of data obtained from the study as well. Finding the right participants for a study takes time and effort. So last-minute attempts will result in inefficient enrollment, and consequently the right candidates may be missed, or ultimately impacting the quality and validity of your study findings. Awareness of the trial may help expedite the recruitment process. A 2001 survey of cancer patients by the Harris Interactive Society showed that 85% of patients were either unsure or unaware of the option of participating in a clinical trial upon receiving the diagnosis, although 70% of them said they would have loved to enroll had they had known. Patients are usually unwilling to participate in a clinical trial because of their lack of understanding of what it is and what it entails and why they need to participate. Patients need to understand that enrolling in a clinical trial not only offers an opportunity to access the latest potential treatment options, but it also presents an opportunity for them to contribute to medical advancement. Experts agree that one reason for slow patient recruitment in clinical trials is because of the poor knowledge of innovative recruitment tools such as those available online. Harnessing the potential of technology and finding and recruiting patients saves a lot of time and money. A strong and targeted online or social media campaign helps to find the right participants for a study and to speed up the enrollment process overall. The consequences of delays in patient recruitment for clinical trials are enormous, ranging from delays in completing the study, huge financial losses, or even worse, failing advancement in the patient care. Therefore, it's imperative to take proactive steps to prevent delays and ensure smooth running of patient recruitment.